that you always have to, promote, is the benefits of the breast milk. Because anytime we can meet a pregnant woman or a breastfeeding mother, we can encounter that, and we have to have that you know just a few seconds that we can tell that mother, that will really change your mind about breastfeeding. Because some mothers, they probably would just have planned on just breastfeeding for a short time, or if you meet a pregnant woman and she wasn't planning, you can change her mind, encourage her, and tell her the benefits of breastfeed milk and the risk that they're putting into their body and to that baby's life and body. Because if you breastfeed that baby, there's a lot of factor that is really a challenge when you are a certified breastfeeding counselor. It's just because every woman has a different child upbringing and culture, or ways. And say if a mother is not used, like their family, the background of the family are not used to breastfeeding, she most likely will not, right? And it will be right off the bat, it won't be in her top of the list, right? Unless we educate these women, we inform them of the risk. And of course, people know about the benefits, right? We all know milk is good, but to what extent do we really know is what they really need to know, right? So it's our job to really paint out for them. And the painting is is a matter of identifying the type of woman that you're going to be dealing with as clients, right? Young mothers, single mothers, low income, will not have all that time. So if you're teaching them, counseling them, it has to be really, you have to tailor that presentation, or for them to adopt easily, to absorb that information. So therefore you're going to be doing visual, visualize it to them. Because keep in mind, single mother won't have that time, whether they know of what you were about to say or they have a little knowledge. Sometimes it's timing, and it's best that we keep giving them some hands out. That And also, as a certified breastfeeding counselor, you will be asked questions such as, oh, I don't think I am going to breastfeed. It's because my breasts are really naturally small. And you have to, to have that, purpose to help them, to give them that detail that, it's not about the size. The milk production is not about the size. And that women's breasts are not for anything but for feeding a child, and it's meant for that. God's given that for that purpose, for that reason. And therefore the ability to produce milk, it's not upon the size. So it's a must that we have that handout at all times. So when we encounter even a pregnant woman or a breastfeeding mother, we can give them that handout right away. It's really important, because especially a teenage mom, something visual, and then something that will give caught their attention right away, because they're young. And imagine a young mother, not even fully developed yet, but raising a child, right? And you gotta catch them and do ways of a presentation that will really be interest to them, like more on electronics and apps and all that. They will morely adapt to that. They'll listen to it more, or they'll be interested in following that more. Therefore your message will be more absorbable to every type of women out there. We also have to consider, not because they're adult and they're educated, that they will be open to all the information that you're offering them. Keep in mind, like I said, being a counselor, there's a challenges that, you know what, some of them will probably have some opposing mark, or will give you that, you know what, I'm very educated, I know this, and I don't need to be told, you know. And we have to be ready, addressing them in a very professional way. And of course, you know, we have to be very understanding, ready to listen. Keep in mind, being a mother, being pregnant, having a newborn baby, and breastfeeding them is really a challenge. So, you know, listening to them and not being judgmental of any reaction that they may give you is really a factor, being a counselor. And you know, again, I would like to stress this out, that we have to be ready, in a matter of few minutes, or sorry, few seconds, to tell them that, you know what, the benefits of breastfeeding your baby is really, really important. And inform them right off the bat, right there, the risk that, you know, they also will have if they don't, continue to, breastfeed their baby. Because some mothers, they have this plan of just breastfeeding for 3 months, is because they think that their their breast will actually, have that, elasticity, issue. Keep in mind that those doesn't happen during the breastfeeding part. Those things happen, and I can send you the link, I could give you some information, but these things happen during pregnancy. So, planning on limiting the breastfeeding, time to up to, it's supposed to be 1 year or more. It depends on the baby and the mother. If both parties are agreeing to go further, and there's that communication between the baby, then it should go further than 1 year. But that is what is the regulated 1 year, right? So if a mother comes to you and she said she doesn't want to plan on going further than 3 months, you know, it's our purpose, it's our aim to really encourage, but not pushing it. We have to listen and address it in a way that, how can we help that person? You know, the baby